Case study involving chloride. The physiological functions of the electrolyte. The electrolyte involved in the case to be studied is chloride. But first, let me shortly discuss what is electrolyte. Electrolytes are essential minerals and are often associated with dehydration. Electrolytes are substances whose water solutions conduct an electric current. On the other hand, chloride as an electrolyte helps in maintaining proper hydration and keeps amount of fluids, maintain blood pressure, and volume of the blood. So the second part of the case study is the case study presentation, in which it includes the patient assessment, etiology or cause of the electrolyte imbalance, diagnostic tests and results, implication or conclusion, drug therapy applied, and management. The patient assessment. Based on the case given, a 53 years old patient is diagnosed with Crohn's disease and experienced many symptoms for several times, such as gastrointestinal pain, burning in the stomach, vomiting, and sometimes with blood. What is Crohn's disease? A Crohn's disease is a form of inflammatory bowel disease and affects the colon and the last part of the small intestine. The patient was also diagnosed with peptic ulcer and bleeding in the upper gastrointestinal due to usage of prednisone. And upon checking her vital signs, it was known that she's pre-hypertension and the breathing is fast. With the usage of nasogastric tube, it helps her to intake nutrients. And experiencing dehydration and loss of blood, the lactated ringers is used as treatment. Lastly, the physician instructed medications to help relieve the patient's pain and for treatment.
The etiology or cause of the electrolyte imbalance. But before we discuss the causes, what is the electrolyte imbalance first? Electrolyte imbalance happens when certain minerals the body needs to function became imbalanced. These minerals include calcium, chloride, magnesium, phosphate, potassium, and sodium. Based on Ms. Mori's case, the first cause was reduced absorption of sodium, chloride, and calcium. Next is increased potassium secretion, and last, impaired secretion and absorption of electrolytes. The colonic absorption of sodium and water was impaired and the secretion of potassium increased. The movement of electrolyte across the colonic mucosa into the lumen was increased and the movement in the opposite direction reduced.
Person with the Crohn's disease test result, which shows the sodium level, potassium, chloride, hemoglobin, and hemochromate are not normal, which is lower than the normal range, which shows here. Sodium level or sodium result shows that it has 130 milliequivalent per liter than the normal range of 135 to 145 milliequivalent per liter. And also potassium level that shows 2.8 milliequivalent per liter, that is lower than 3.5 milliequivalent per liter to 5 milliequivalent per liter. Chloride 92 milliequivalent per liter, that is lower than 96 milliequivalent per liter to 106 milliequivalent per liter. And the calcium level shows that 9 milligram per deciliter, which is normal because the normal range is 8.2 mg per deciliter to 10.2. And also the magnesium, it is normal, and also the magnesium is 1.3 milliequivalent per liter, and the normal is 1.3 to 2.22 milliequivalent per liter. And the hemoglobin is 9 grams per deci, liter. That is lower than the normal, which is 12 to 16 grams deciliter. And hematocrit is 27%, which is lower, as we can see, the normal range 38% to 40% of hematocrit. A person which experience or which has lower sodium level can indicate to hyponatremia. Hyponatremia, a person with hyponatremia can typically experience lethargy, fatigue, exhaustion at first, but they can also feel muscle twitches, seizures, and eventually become unresponsive if it's worsened. And if that person, we can use emergency medication and intravenous fluids if it's worsened. But if it's not that worst, restriction on excessive fluid and intake and diuretic may help. And when a person has a potassium level that is low, it can indicate in hypokalemia. As we can see, hypokalemia. Hypokalemia. A person that has hypokalemia or lower potassium level can experience weakness, cramps, twitches, irregular rhythms of the heart, and if it's person, it can become a paralyzed person. A person which has hypokalemia or hypokalemia, most common cause is excessive potassium loss in the urine due to prescription medication that increase urination. Those medication that prescribe that increase urination can cause potassium loss. And a person with a chloride lower level can indicate to heart failure, lung disease, Addison disease, and an Addison disease is a disorder that does not produce enough of certain hormones in the body's adrenal glands. And hypochloremia may also occur where a person can experience loss of fluid, dehydration, exhaustion, fatigue, breathing problems, and diarrhea. But always remember, when you can feel dehydration or exhaustion or fatigue, it doesn't mean that your chloride level is low. Don't assume, but you can go to your doctor for further test result para ma-confirm. And the next one, as I discussed, calcium and magnesiums are both normal, and the hemoglobin is lower than the normal range of hemoglobin, which is, as we all know, a person with or has a hemoglobin level that is lower than normal range can indicate to anemia. Anemia, we are all familiar that anemia is a medical disorder in which the amount of number of red blood cells is lower than the normal red blood cell count. And the causes of anemia can be blood loss, nutritional deficiency or iron deficiency, problems with the bone marrow, kidney failure, and irregular hemoglobin structure, which is you don't have enough hemoglobin in your blood. By increasing iron intake or eating food that is rich or that are rich in iron or optimizing iron intake and supplements, it can raise your hemoglobin or red blood cells count. And also hematocrit, and hemoglobin are like the same, but it's not really the same because hematocrit is the proportion of blood by volume that consists blood cells. It is by percentage, and a person with hematocrit that is lower than the normal range can also referred as anemic or anemia. They are also has the same causes, which is blood loss, nutritional deficiency, problems with the bone marrow, kidney failure, and abnormal hemoglobin that causes anemia. And also by eating foods that are rich in iron and optimizing iron or intake of supplements that rich in iron can raise the level of your hematocrit or hemoglobin, which you can go to your doctor or run some tests and ask for advice or proper treatment. For the implication or conclusion, sign of symptoms: gastrointestinal pain, burning sensation in the stomach, vomiting profusely, emesis contain large amount of bright red blood, and gastrointestinal bleeding. The electrolytes imbalance result in the case or vomiting and abdominal pain. For the medical intervention, according to the patient's case, she has a low potassium, sodium, and chloride. The doctor should order potassium drip and change the serum to plain NSS. The patient's condition is confused because of the hyponatremia and because of the low sodium levels. If the condition is low of sodium levels, it may affect the brain. It can also lead to seizure. For some instances, if the patient has electrolyte imbalances and heart attack, the potassium level will become abnormal. The NGT tube can monitor bleedings. The patient's case vomit profusely, then she should undergo blood transfusion, PRCB. And the pantoprazole drip for ulcer and upper GI bleeding.
These are the drugs for our drug therapy applied. The first drug is azathioprine, which is sold under the brand Imiran, has a dosage of 50 milligrams, and should be taken once a day. The next drug is cimetidine, which is sold under the brand Cimetidine, has a dosage of 400 milligrams, and should be taken once a day. The third drug is loperamide, which is sold under the brand Imodium, has a dosage of 4 milligrams, and should be taken once a day. The next drug is famotidine, which is sold under the brand H2 Block, has a dosage of 20 milligrams, and should also be taken once a day. The next drug is cefoperazone, which is sold under the brand Sulbacef, has a dosage of 1.5 grams, and should be taken every 12 hours. And for the last drug is hydrocortisone, which is sold under the brand Cortef, has a dosage of 20 milligrams, and should be taken twice a day. For the dietary modification, which are the changes made during food preparation, processing, and consumption to increase the bioavailability of micronutrients and reduce micronutrient deficiencies in food for an individual. First is for omega-3, polyunsaturated fatty acids should be added as they have an anti-inflammatory effect and protect stomach from ulcer. Second is to avoid spicy foods. Third is to avoid late night meals. Fourth is to take healthy balanced diet having low cholesterol. And for last is to take plenty of water and fresh juices. For the lifestyle modification, which involves altering long-term habits, typically of eating or physical activity, and maintaining the new behavior for 4 months or years. The first one is to avoid lying down in bed immediately after a meal. Next is to elevate head of bed. And last is to avoid stress.
So moving on to the management, we divided this into 2 sections, the short-term management and the long-term management. And we only concentrated on the nursing interventions and how to manage the patient's current situation. First of which, electrolyte imbalance. We emphasized that the relevance of maintaining proper nutrition and hydration is needed. Next was to administer parenteral fluids as prescribed. Consider the need for an IV fluid challenge with immediate infusion of fluids for patients with abnormal vital signs. Next was to record intake and output accurately to monitor real function. For management of vomiting, which was common to metabolic acidosis, position the patient to prevent aspiration. And lastly, to provide good oral hygiene after incidents of vomiting, use of sodium bicarbonate wash to neutralize acid in the patient's mouth. For the long term, the patient, while taking steroid medication, should be taken after a full meal or with antacids, as this may reduce the irritation of the stomach, and steroids can increase your appetite. And lastly was to follow up on her conditions, monthly checkups, of which is needed, and or rehabilitation to help the body adjust from the current stress that it handles. And last, the principal correlation. First of which, chloride is an ion, and ions are negatively charged, which was discussed in Unit 1 in the properties of elements. Next was the properties of solutions, specifically electrolytes, which was discussed in Unit 2, and electrolytes meaning substances of water solution that conducts an electric current. And lastly, since electrolytes help maintain fluid imbalance through osmosis, which was also discussed in Unit 2, which osmosis is a process where water moves through the wall cell membrane from a diluted solution towards a more concentrated solution. And this last part mainly concentrates on the homeostasis, or the body's natural response to fluid imbalances. That is all. Thank you.